Good morning, good afternoon, good evening from every part of the world where you may be joining us from. You're welcome to another episode of How Not to Do First Aid. You're welcome. Once again, you're welcome to this free first aid course from Educate. Today, we are going to be talking about stroke. But before we start, I want to ask you some questions. Is this statement true or false? 1. A lot of people believe that stroke is a disease not for the hospital. Stroke is a disease not to be exposed to injections. True or false? Some other people believe that stroke cannot be really treated. Once you have stroke, then that is the end. True or false? Some other people believe that recovery from stroke only takes a few months after the incidence. Is it true or false? Somebody and several other persons said on the platform that stroke only happens to elderly people, older people. True or false? Some other people believe that there's nothing one can do to prevent stroke, that it is actually a result of witchcraft, or what the Yoruba people would say, Ategun Fesi. Is it true or false? Some other people believe that once stroke affects the ability to speak, then one cannot regain speech again. Is it true or false? I have to tell you now, and with all sense of responsibility, that every single statement above is entirely false. Now, let me share with you some fact that is known about stroke. The first thing is that stroke is a disease that should get to the hospital within 3 to 4.5 hours. This is the only time frame that the brain cells can be salvaged, can be saved. Anything beyond 4.5 hours would have resulted into a permanent death of brain cells, and there would be nothing to be done to help the person reverse the effect of the stroke. So all there is to do is just to begin rehabilitation, to begin physiotherapy. Nothing can be done about those cells that had been permanently damaged by stroke. Then the other thing is that immediate emergency treatments can change a stroke victim's chance of recovery. The faster you get the person to the hospital, then the earlier that interventions can be done, and the possibility that this person would fully recover from the effect of the stroke. Then I must tell you that some victims of stroke would continue to recover for the rest of their lives because of residual disabilities that stroke would cause to the victims. Anyone at any age can have a stroke, be it an adult, a child, and a teenager. So the thought that stroke only affects elderly people is entirely not true. Stroke is largely preventable. In actual fact, stroke is one of those debilitating, one of those serious diseases that can be entirely prevented if we take conscious actions. We will talk about the various ways we can prevent stroke as we go along in this lesson. And I must also add that stroke victims can learn to speak again. Yes, depending on the area of the brain that is affected by the stroke. Sometimes when the speech center is affected, a stroke victim would completely lose the ability to speak. However, the good news is that the person can learn to speak again. What are the other known facts about stroke? It will surprise you to know that in a research that was conducted in South Africa, 17% of people over the age of 50 are unable to mention one single symptom of stroke. Yeah. It was also discovered that 60%, 6 out of 10 patients don't get to the doctor's office until 24 hours after the stroke. Recall that I mentioned that the only window where a stroke victim can be helped is between 3 hours and 4.5 hours. Now in Nigeria and indeed in the African subcontinent, we don't get to the hospital. 6 out of 10 stroke victims don't get to the hospital until after 24 hours. And then 13 hours seems to be the average time from the time of the stroke when individuals resort to medical help. You know, here in Africa, when diseases strike, especially one that is as sudden and as devastating as stroke, the first thing that comes to mind is, oh, this has to be a spiritual attack. Let us face it with spiritual means. Let us use traditional means. Let us use, in actual fact, a friend of mine who recently came down with stroke had an advice that, oh, okay, see, this is not a hospital situation. I know somebody who, with mere 50,000 naira, this person would completely get healed within 6 days. They even put duration. They say within 6 days, this person is going to completely get healed, get cured from the stroke. The reality is that you will pay the 50,000 naira and this person will not get any improvement and you won't get your money back. So let us be wary of this. Now, these statistics that I've just discussed is courtesy of Heart and Stroke Foundation of South Africa. Now let us start. Let us go to the meat of the matter. What is stroke? Stroke is the interruption of blood to the brain, resulting in damage to brain tissue. When the blood supply to the brain is cut off, then that area of the brain that is supplied by that blood vessel begin to die, and that is when stroke results. See, the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. So when stroke affects the right side of the brain, the individual will lose the ability to use the left arm or use the left leg, or you would observe that the left half of the face is paralyzed. The alternate would happen when the left side of the brain is affected. Then the person will lose the ability to use the right arm or the right leg, or having the right side of the face paralyzed. There are two types of stroke. We call one ischemic stroke, which is the commonest that we see around. I will explain this. It is as common as 8 out of 10 issues of stroke is ischemic. Whereas the hemorrhagic, that is a stroke where you have bleeding into the brain, constitutes only about 20%. Now let's look at ischemic stroke. Ischemic stroke. When we have blockade in an artery in the brain, either by blood clots or by total occlusion of a blood vessel, thereby, as you can see in this diagram, you will notice that this is blood vessel, this is blood vessel, this is the blood vessel, as you can see. Then you will see that at the inner part of the blood vessel, you have this accumulation of fats. All this white thing you're seeing here, this white thing here are damaging fats that accumulate over time. So when you are accumulating fats in the body, you are also accumulating fat inside the blood vessels. So as you can see, it was gradually closing up the flow of blood. Then when you now have a blood clot, this is a blood clot here, then you now have complete blockade of blood. All right, now if you look at this place, you will see that this is where we have the blockade, and the area of the brain supplied by that vessel is beginning to turn gray. That means the blood vessels here are beginning to die off. And as it happens, then that part of the body that is controlled by this side of the brain will begin to lose power, will begin to lose the ability to use that particular aspect of the brain. This is called ischemic stroke. Stroke that is as a result of blockade of blood flow to the brain. The other form of stroke is the hemorrhagic stroke. Hemorrhagic stroke results when there is bleeding into the brain, when a blood vessel bursts and blood begins to spill into the brain tissue, thereby killing off the essential area of the brain. As you can see, this represents a blood vessel which has ruptured here. It has ruptured, and you have spilling of blood into the blood vessel. All right, now see here, this is where you have the bursts, and you have blood spilling into this area of the brain. And of course, you will begin to see that that portion of the brain is beginning to turn gray. You can see this gray color here. It shows that there is lack of oxygen supply to that portion of the brain, and eventually the brain cells around this area are going to die. And that part of the body that is controlled by that section of the brain is going to lose function. You are going to lose the ability to use them. Right? Now there is a third form of stroke that is not usually common because it is transient, it is temporary. We call it transient ischemic attack, or TIA. This is a kind of stroke that lasts only for a few minutes and up to a few hours, right? It is called a mini stroke or a warning stroke. You know, you will just lose the ability to use part of the body. All right, maybe you're trying to pick your phone and your phone keeps falling down. You try again and again, it keeps falling down, and and after a while you just recover from it, and you're like, oh, okay, what happened to me? What happened to me? So this is a warning stroke. All right, and TIAs can and is usually followed by a full-blown stroke if care is not taken immediately when such a mini stroke is observed. All right, so there is a need. Once you experience a mini stroke, you need to get to the hospital. You need to let the doctor realize that you now know that what has happened to you is not something to be held with levity. You know you have suffered a mini stroke. Please let me know where the problem is coming from. Let me know what I should do to prevent a full-blown stroke, from to prevent me from becoming a victim of a stroke paralysis. So immediate action must be taken. Now, what are the signs and symptoms of stroke? How do you recognize stroke? We are going to use the FAST acronym. FAST is the shortened form of the symptoms and signs of stroke. What is F? F representing the face. Whenever there is numbness or paralysis or drooping of one half of the face, you may not know as someone who has suffered stroke, but the people around you would observe that a segment, one half of the face has dropped. This line that usually appear when we smile or when we frown would suddenly disappear on the side that is affected. So we have facial droop, right? The second sign is A, arms, all right? There is weakness in one arm, all right? And you may even experience numbness in one arm. That is the arm that when you try to stretch the hands, it continues to drop. You cannot keep it up. It continues, no matter how hard you try, the hand will continue to drop. And the third one is speech. Usually, the speech is affected. You ask the person, please, what is your name? He's struggling to mention the name. You're trying to ask him to say simple words, like, what is today's date? And he's struggling. He knows it. He wants to say it, but he cannot say it. Or at best, he says some things that may not really be comprehensible, So speech, slurred, it becomes slurred. And T, that is the time to immediately seek medical attention. That is the time to take this person to a facility, a hospital that is capable of CT scan, a hospital that is capable of MRI, a hospital that is capable of stroke treatments. We will talk about the challenges we face here in this part of the world concerning all these treatment modalities that I'm trying to mention here. Now, what are the other signs and symptoms of stroke? Sudden headache. In actual fact, the first and the only sign of stroke that someone may experience is sudden severe headache. And there are instances where someone just scream, grab the head, slumps and die. And you begin to wonder what has happened. And of course, different kinds of explanation for things we don't understand. It is possible that this person has suffered a major rupture of blood vessel into the brain, and we have accumulation of blood in the brain. The skull itself cannot expand. So when blood continues to accumulate, there is pressure, and this pressure causes headache, serious headache. And when the pressure continues, especially when the leakage is massive, it takes, this person will die within minutes. And this thing sometimes happens at night when we sleep. So somebody will scream from sleep and die within a few minutes after. And then we begin to form or try to make some form of explanation for it. So there could be loss of vision in one eye. Loss of vision in one eye. You just suddenly go blind in one eye. It may be a sign of stroke. You begin to lose balance. You begin to bend, towards one side as you try to walk. It could be a sign of stroke. We could have loss of consciousness. We could have tingling sensation that Yorubas call paja paja. On one half of the body, it could be a sign of stroke. And when you experience any of these symptoms, do not wait and see. Do not experiment with other ideas. Approach the hospital and seek medical treatments. How do we manage stroke in Nigeria? The management of stroke here is largely preventable. And why is this? Number one, just like we have mentioned earlier, there is delay in seeking health care, which renders any form of treatment ineffective. So what we are left with is rehabilitation. Okay, you can't use the right arm and the right leg. Let us begin to rehabilitate. We invite the physiotherapist continue to do its work, and recovery might commence over time. There is also lack of or high cost of imaging facilities. What do I mean here? How many hospital facilities have CT scan in our country? How many hospital facilities have MRI in our country? All right, and even the few that has, what is the cost? Is the cost of affordable for an average person who has suffered a stroke? Even when you are able to get this person to the hospital in time, the cost for stroke treatment is enormous. So how many stroke victims will be able to afford the cost of treatment? Now, for few patients who are qualified, all right, there could be other contraindication, because the treatment for stroke, that drug that will melt whatever it is that is blocking the blood vessel, have a whole lot of side effects. So the patient will need to be screened, and only a few are qualified to even take that particular drug, such that we will not have another problem in our hands that may even be worse than the stroke that this person has. And it is also interesting to note that there's very few health insurance, but unless you go for they call it the platinum policy, a policy that, okay, you have an emergency, they will call an air ambulance to come and pick you from wherever you are. The air ambulance and helicopter ambulance will come pick you up, take you to the hospital, and all these different treatments will start. Now, how many of us can afford such luxury? And the interesting thing about that also is that even those who could afford such luxury would only have their eyes outside the country. And I don't know if something happens this hour, how you will get to the US within 3 to 4.5 hours, how you will get to the UK within 3 to 4.5 hours. All right, these are things that our government functionaries should think about, before they neglect healthcare system in our country, and whenever they have issues, they fly out. When they have stroke, before they get to the US or the UK, they must have suffered permanent brain damage. That is for sure, because you can't get there within the window of time that something tangible can be done to reverse the damage. So, and lastly, very few stroke victims can afford CT scan and MRI. So we lay a lot of emphasis on stroke prevention in our country, Nigeria, and indeed in so many other countries in the world, especially third world or middle income countries, because only a very few facilities available for the very few people who could afford it. Now, let us consider our risk factors. The risk factors for stroke. Number one, there are basically two. We have those risk factors that are not modifiable. There's nothing you can do about them. Once you have them, you have them. We call them non-modifiable risk factors. And the other one is the risk factors that you can do something about. That is the modifiable risk factors. Now let's talk about the non-modifiable risk factors first. Number one, if you are 55 years old or more, then stroke can happen to you. Age is a risk factor. In actual fact, we now have individuals that are less than 50, getting knocked down by age. I'm talking about stroke that is age-related now, not stroke that is caused by other disease conditions like heart conditions, which may cause stroke in any individual, whether a child, a teenager, or an adult. All right? If you have a family history of stroke, then you should take care, take caution. It could happen to you, because the factor that has caused stroke in a close member of the family, you may also have inherited such factor, and you need to take caution. Thirdly, if you're a man, stroke is commoner in men than women. When we look at the other conditions, we may begin to hazard, guesses where you have stroke, being commoner in men than in women. All right, but that is just the reality. Then the black race. It is commoner amongst us black than other races, than Caucasian. In actual fact, in the US and the UK, it is commoner among the black community than the Caucasian community. Those are non-modifiable. You are a man with family history of stroke and is older than 55 years old, you must take caution. Now, which are the modifiable risk factors? It could be medical. If you have high blood pressure is the number one risk factor for stroke. And high blood pressure will cause that type of stroke that we refer to as hemorrhagic stroke. As pressure continues to build up, it's like blowing air in a balloon. If you continue to blow air in a balloon continuously, the end product will be a pop. The balloon is going to burst. The same thing happens when blood pressure continues to rise unchecked. The blood vessel continues to accommodate until it reaches a elastic limit and it bursts, it ruptures. And because the blood vessels in the brain are very delicate blood vessels, so many of these ruptures, occur in the brain. So if you have high blood pressure or you have family history of high blood pressure, you need to take caution. Diabetes, stroke is commoner in diabetes. High cholesterol is a recipe for stroke. If you have suffered stroke before and you are not managing your health properly, there's possibility of a repeat stroke, which usually is more devastating than the previous one. So you want to take caution. Heart conditions, heart conditions can actually result into stroke when you have, we call something atrial fibrillation, when the heart is beating abnormally fast. So you have mixing of blood, and by so doing, you may have precipitations. Some of the blood will just clot, and the clot will begin to travel around the blood vessels until it gets to the brain and blocks, the supply of blood to a particular portion of the brain, and the person will come down with stroke. We also have another aspect of modifiable risk. The ones we have discussed is the medical modifiables. If you suffer from any of those disease conditions and you are managing it properly, then your chances of coming down with stroke becomes minimal. This lifestyle, sedentary lifestyle, I will continue to repeat and repeat and repeat again that we need to incorporate a form of exercise into our existence. Otherwise, the system will so get bogged down, the flow of blood will be sluggish, and it will encourage the formation of clots, which may block blood vessels to the brain and will come down with stroke. Overweight. If you are overweight, we need to check it. Overweight usually is also hereditary. So the fact that you have inherited a very large body size from your parents does not mean that you have to just abandon your system to whatever could happen to it. All right? You can always make conscious efforts to keep the weight within reasonable limits, and make conscious effort to ensure that you exercise, make conscious effort to ensure that you do not develop all the complications that are associated with being overweight. Excessive consumption of alcohol is the recipe for disaster. So we need to watch it. Stress in moderate quantity is fantastic. It gives us the drive to pursue our goal. It gives us the drive to pursue our mission and vision and ambition in life. However, excessive grinding stress that is taking away our sleep, that is taking away our rest of mind, our peace of mind, month in, month out, year in, year out, will eventually knock us down. All right, so we need to check it. Smoking is a big recipe, a fantastic recipe for stroke. So if you smoke, you are a disaster waiting to happen. So you need to check it. All right? And for people who are using illicit drugs, the cocaines of this world, the heroines of this world, the other things that our young people are consuming on a daily basis, in the next 20, 30, 40 years, the population of stroke victims is going to rise and rise very, very sharply because of what is being consumed by our young ones in the current situation. Now, you need to consider your own risk for stroke. What are your risks for stroke? All right? If you have two or more of the risks that we have highlighted, either medical or lifestyle, then you are a candidate for stroke. You have medical risk factor, hypertension, diabetes, heart condition, overweight and all whatnot. and you have sedentary lifestyle, you don't exercise, you smoke, if you have 2 or more risk factors, then you have a higher chances of developing stroke. So, what are your risk factors for stroke? This is a summary. Are you hypertensive? Manage it and manage it well. Do you have diabetes? Manage it and manage it well. Do you have high cholesterol? Go and check. If your cholesterol level is high, you need to manage it and bring it down. Have you suffered TIA before? Have you suffered stroke before? You need to watch every aspect of your health so that you do not suffer a second stroke, which is usually more devastating than before. Do you have heart conditions they call atrial fibrillation? You need to get it treated. Are you a student? Do you just sit down from morning till evening and get home and sit down and sleep and sit down in the office over and over again? It is a recipe for disaster. Are you overweight? You need to check it. Do you use alcohol? You have to moderate it. Do you experience excessive stress? You need to consciously do something about it. Otherwise, it is going to knock you down, and those things that you are running after will eventually become useless for you. Do you smoke? You need to cut it off. Do you use, unprescribed, or do you abuse drugs, or you use other illicit drugs? You need. The video we're going to see now is a summary of the entire lesson. Take a listen.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via 2 major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. In contrast, during a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, in an intracerebral hemorrhagic stroke, a blood vessel bursts, spilling blood directly onto your brain, while robbing the intended tissue of nourishment. Both the hemorrhage and ischemia destroy brain tissue. A subarachnoid hemorrhagic stroke occurs when a weak spot in a blood vessel wall, called an aneurysm, bursts and leaks blood into the tight space between your brain and your skull. The high-pressure bleeding results in serious damage to brain tissue. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, You may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke. In the case of hemorrhagic stroke, emergency surgery may be necessary to repair damaged arteries or reduce the pressure of the blood on your brain. You may be given medication to help the brain's blood flow return to normal.